Good day. This time, I'm going to give you some focus about diseases. So, let's start. The first that I would like you to know is about multiple sclerosis. What are the things that we need to remember? First, visual disturbances is a common initial symptom. Second, it's chronic and progressive. And third, an accident that occurs with the disease increases the risk for injury. Let's use this concept to answer a question. Which of the following interventions is a priority for a client with multiple sclerosis? A. Prepare the client for tracheostomy. B. Apply a patch. C. Facilitate bowel movement. D. Increase fluids. The answer is letter A. Prepare the client for tracheostomy. Why? Because a client with multiple sclerosis will eventually have respiratory problems which will make it difficult for them to breathe. The second disease that I'm going to emphasize is Myasthenia Gravis. What are the things that we need to remember? It involves fluctuating weakness of muscles innervated by cranial nerves. Symptoms are more severe in the evening. There is difficulty in swallowing of saliva, which may increase the risk for aspiration. Muscle strength decreases with repeated muscle use. And of course, our priority, airway. Let's use the concepts to answer the question. The most significant initial nursing assessment in Myasthenia Gravis includes A. Ability to chew and speak distinctly. B. Degree of anxiety. C. Ability to smile and close the eyelids. And D. Respiratory exchange and ability to swallow. No, we said earlier that the client has a difficulty in swallowing saliva. So the priority, therefore, is letter D. Respiratory exchange and ability to swallow. The next drug that I'm going to emphasize is heart failure. Take note. Heart conditions is actually the #1 cause of morbidity in the Philippines. So, let's pay particular attention to these concepts. Left-sided heart failure develops first before right-sided heart failure. Therefore, it follows that dyspnea occurs first before edema develops in a client with heart failure. Next, the initial sign of left-sided heart failure is dyspnea, and the initial sign of right-sided heart failure is neck vein distension. The priority of the client, pay particular attention to this, rest and avoidance of stress. Let's use those concepts to answer the question. A client with right-sided heart failure initially exhibits A. Dyspnea, B. Moist rolls, C. Neck vein distension, and D. Edema. The answer is actually letter C. Neck vein distension. No. You will ask me. It is also possible that edema could occur in client with heart failure, right? Of course. But the question is asking for the initial manifestation. You have the keyword initially in the question. So you have to pay particular attention to that keyword. So the answer is letter C. We all know that dyspnea and moist rolls or anything that has something to do with the lungs or pulmonary circulation occurs in left-sided heart failure. The next disease is Addison's disease. No, Addison's is an endocrine problem involving the adrenal glands. What are the things that we need to remember? It requires lifetime medication just like any other neuromuscular or neuroendocrine disorder. Monitor the blood pressure because hypertension could become life-threatening in a client with Addison's disease. And of course, the laboratory data reflects hyperkalemia. So, let's answer a question related to those concepts. The priority intervention for a client with Addison's disease is to monitor the A. pulse rate, B. blood pressure, C. respiration, and D. bowel movement. The answer is letter B, blood pressure. Next drug about medical surgical nursing is renal failure. Study these very well. Let me highlight some important key points that you need to remember. First, infection is the most serious complication of acute renal failure. Second, anemia is a common complication from renal failure. Take note, in anemia, there occurs the 3F, fatigue, fainting, and forgetfulness. Cottage cheese is allowed, and edema and pruritus indicate renal insufficiency. Therefore, if these symptoms occur, it's better for the nurse to report it to the physician because it's indicative of a complication. Now, let's answer a question related to those concepts. A client with chronic renal failure presents a high priority problem which is A. Edema, B. Polyuria, C. Fatigue, and D. Headache. No. It states in the question, high priority problem. Pay particular attention to the word chronic. So there's a big difference between the problems experienced by a client with acute renal failure and a client with chronic renal failure. The answer to this question is C. Fatigue indicates anemia, which is a life-threatening concern for a client with renal failure, specifically chronic renal failure. And what drug is usually given to stimulate RBC production? It's epigen. Next, we have Parkinson's disease. Take note that it is characterized by shuffling gait, low-pitched monotone voice occurs, drooling may cause aspiration, therefore the priority is safety. But you have to remember very well that in case you are being asked about what to prioritize, is it drooling or the presence of the shuffling gait, okay, it's better actually if you pay particular attention to how the question is constructed. If it has some reference to respiratory problems related to Parkinson's disease, then the answer is drooling, because it may potentially lead to aspiration, which may potentially again obstruct the airway, creating breathing difficulty for the client. So let's answer a question related to those concepts. Which nursing diagnosis is a priority for a client with Parkinson's disease? A. Diarrhea. B. Constipation. C. Risk for aspiration. D. Altered thermoregulation. The answer? C. Risk for aspiration. Next, let's talk about Alzheimer's disease. What are the things that I want you to remember related to this condition? It affects acetylcholine. Now remember, acetylcholine is the neurotransmitter that helps in preserving one's memory. Sundown syndrome occurs. Sundown syndrome refers to confusion that occurs in the afternoon. Then, confusion is initially manifested by the ability to balance checking accounts. The disease is progressive, and the most important thing of all, always remember, your priority should be frequent orientation. Remember, Alzheimer's disease is a cognitive problem, so prioritize the cognitive manifestation of the client. So let's answer. The priority in the care of a client with Alzheimer's disease is A. Orientation, B. Safety, C. Airway, D. Maintenance of medication regimen. The answer is that I'm telling you, it's orientation. Why? Alzheimer's disease is a cognitive problem. So the answer is letter D. Let's talk about paraphilias. Let's pay particular attention to pedophilia, which involves sexual stimulation with children. It may involve the use of technology like computers and phones. So let's answer a question. Pedophilia involves sexual stimulation with A. Animals, B. Dead person, C. Young children, and D. The elderly. Remember, zoophilia is a sexual stimulation with animals. Necrophilia, sexual stimulation with a dead person. So the best answer between two extremes of ages, we have letter C, young children, letter D, the elderly. The answer is letter C. Next, let's talk about phobia. What are the things that I want you to remember? It involves irrational fear, and the client recognizes that the fear is irrational. Monophobia is fear of being alone. Agoraphobia is fear of being alone in public places. That's different from social phobia, which is fear of public embarrassment. Now remember, the ability of the client to move out of the house, even for a very brief period of time, like visiting the mailbox, or just actually attempting to open the window or the door, is in itself indicative of improvement on the part of the client. Let's answer some questions. A question related to those concepts. A client with phobia recognizes that the fear is A. triggered by a specific situation, B. irrational, C. associated with anxiety, D. all of the above. No. If you're sure that A and B are already correct, then it's most appropriate to answer all of the above, because there's not going to be a question with two correct answers in a text. Always remember, if you're already sure that two of the items and the options are correct, and another option says all of the above, it's better to choose all of the above. The answer is letter D. And note this because this is a potential question in the format of select all that apply. Next, dysthymic depression. Now, always remember that dysthymia involves chronic depression. It lasts for 2 years in adults and 1 year in children. There's usually an increased risk for suicide. Now, its treatment is usually that of phototherapy, in which involves opening all the lights inside the house. So, let's answer. Dysthymia is characterized by A. severe depression, B. chronic depression, C. short-lived depression, D. chemical imbalance in the body. A depression that's characterized by chemical imbalance in the body is known as endogenous depression. Whereas a depression that is actually severe is classified as major depression. Now, if we talk about dysthymia, as I've been telling you, it lasts for 2 years in adults, so it's actually about chronicity. So the best answer is B, chronic depression. Let's pay particular attention now to pregnancy-induced hypertension. What are the things that I'd like you to remember? It involves hypertension, proteinuria, and edema. Seizures indicate preeclampsia, bleeding indicates HELLP syndrome, and it's treated with magnesium sulfate. Always remember, magnesium sulfate in a client who is actually having pregnancy-induced hypertension is primarily aimed at preventing seizures. And you have to monitor BURP, that's your birth, blood pressure, urine output, respiratory rate, and patellar reflex. Let's answer a question. Which of the following manifestations, if exhibited by a client with pregnancy-induced hypertension, needs to be addressed first? A. Dyspnea, B. Hypertension, C. Edema, and D. Bleeding. Now, no. You have here actually several signs and symptoms that is exhibited by a client with pregnancy-induced hypertension. But the most important of all is the symptom that's indicative of a potential complication. Always remember, HELLP syndrome, that could be a complication of pregnancy-induced hypertension, is characterized by H. hemolysis, EL, elevated liver enzymes, and the LP, low platelets. Thus, you have the acronym HELP. So the answer for this question is D. Bleeding. Now let's talk about abortion. Things to remember. Bleeding is a common sign. It usually occurs in the first trimester of pregnancy. The priority is to restore fluid balance, and the diagnostic test of choice, just like in major cases of bleeding in a client who is pregnant, is your ultrasound. Always remember, the diagnostic test of choice for a client who is pregnant and is bleeding is actually your ultrasound. So, question. The client with signs of abortion should be prepared for A. Contraction stress test, B. Amniocentesis, C. Ultrasound, and D. Chorionic villi sampling. Take note. Contraction stress test, amniocentesis, and chorionic villi sampling will all potentially cause bleeding. So it should never be given to a client who is bleeding due to abortion. So the answer is C. Ultrasound.